Namaste. Welcome everybody. This is a trial of sorts for all of us. Dr. Bharath, who's here with us, is an accomplished Ayurveda doctor, and he has a plethora of accomplishments which you have all seen in the flyer. But I wanted to give everybody a brief of what happened. How did this whole thing start? Dr. Bharath and I started interacting through my mother. Dr. Bharath and my mother have been interacting for some time. And I started talking to him for a particular ailment that I had. So it was kind of a pretty selfish interaction to begin with. But very soon I realized his hardcore passion for Ayurveda. Unlike several others I have spoken to, as a physician-patient conversation, it was very apparent that Dr. Bharath was supremely passionate about the subject. He was extremely interested in finding the root cause, curing me. Like, he really didn't care about anything. He would ask me very intuitive questions, and his knowledge was apparent. And then after some time, he started sharing things about his life, what he was interested in, and how he wanted to take his Ayurveda forward, and how his intention to spread Ayurveda, help other Ayurveda practitioners. Subsequently, Naomi and I started talking, and I also spoke to Jeremy, and we realized that maybe there is an opportunity for Western Ayurveda practitioners to interact with somebody like Dr. Bharatji, and where they can get benefited from his expertise. So we gathered around a few questions and shared it with him. And the first part of this conversation is essentially geared towards Dr. Bharath answering those questions. He will also tell what the question is and answer it. And we wanted the second part to be for Dr. Bharath to ask you all a few questions on how the status of Ayurveda is here. How do you guys practice medicine? What's available? What's not available? Etc. Etc. So I'll tell you a very brief intro about Dr. Bharatji. It's all in the flyer, but I'll just mention it briefly here. He's an Ayurvedic doctor. Obviously, he's been practicing for a dozen plus years. He's a research director at Sri Rasi Research Foundation. He has his own practice. He's taught a lot of hundreds of students Ayurvedic topics. He holds a master's and a doctorate in Ayurveda. And he specializes, he holds a doctorate in infertility management. That's his specialization. Obviously, he covers a vast variety of topics. I'm not doing a fantastic justice to his vast repertoire of achievements, but in the interest of time, I'm going to turn it over to him. Essentially, he will say, this is the question I received, and this is how I view it. He might also choose to quote from scriptures if he feels it appropriate, and we'll move on to the next question on that. Once we are done with that part of 5-6 questions that we have sent to him, we'll start with the interaction portion of it. With Dr. Bharatji, without much ado, please, I'm turning over the spotlight on you.
Namaskaram. Hari Om. Shri Gurubhyo Namaha. Om Dhanvantaraye Namaha. Hope I'm audible.
Yes.
Yeah, great. So thank you so much, Sri Ramji, for giving me such a good opportunity, such a wonderful opportunity. I'm always for teaching people. I've always been a teacher when it comes to Ayurveda. Because since the time I have started to learn Ayurveda, I've always been a student. So I've always believed that you need to give what you take. So I always like to teach other people. There is also a small selfish thing in that when I start teaching, I start studying a lot. I start researching a lot. So I also gain from that. It's a two-way street. So yes, I love to teach and I love to learn Ayurveda. So I think, shall we move on to the questions
Yes,
directly?
please. Yes.
Yeah. Okay. Yeah. I think the first is from one Miss Naomi Boas. So she has asked me something about first one is oil pulling. I'm going to go through these things a little bit fast. If we have some questions, we can have that later. So basically, the aim of having this seminar, the aim of having this get together is uh, for I feel Ayurveda has to be a system of medicine which is a worldwide system of medicine and the primary system of medicine. I have seen hundreds and thousands of people getting cured with Ayurveda, not only from me, from many other doctors. That's what has inspired me to take this field. And I feel this is one way through which, or the only way I should say, through which people can get themselves treated and at the same time, also know a little about how to live your life. This is what Ayurveda gives you. The very word Ayurveda is Ayuhu is life and Veda is the science. It is a life science. It tells you, it teaches you how to live your life. And at the same time, it also helps you to treat people if you have the privilege to do so. Um, why I call it a privilege is I have seen many Ayurvedic doctors, even Indian Ayurvedic doctors, going through the whole course of 5.5 years to become an Ayurvedic doctor, and they end up not treating even one patient. That is what we might call karma, right? I mean, some people go into insurance sector, some people go into research sector, and so on. So, Ayurveda, I want this Ayurveda to be a full fledged medical system in the US also. Obviously, the whole world. I also definitely want it to be in the US also. And while doing so, it will also, I think, this will also help you all to have a good footing in Ayurveda. And all the future students of the US also who wants to learn Ayurveda, who want to learn Ayurveda and take it further, I want them also to, gain something from this. That is what is the whole idea of this seminar. So the first question is about oil pulling. Oil pulling, generally, Ayurveda says there are two types of oil pulling, or you can hold the medicine in your mouth in two ways. One is Gandusham, and the other one is Kavalagraha. So this comes in the chapter of Dinacharya in Ashtanga Hridayam. I saw the list of books that you guys have, in your syllabus. So I think Ashtanga Hridayam would be a good book for me to, quote things from. Basically, it comes from Dinacharya Adhyaya, second chapter, Sutrasthanam. After Rasanjanam, he says, Tato Navanam Gandusham Dhuma Tambula Bhag Bhavet. So this part is for after doing the Rasanjanam that they apply in the eyes, you can go for Gandusham, he says. This Gandusha and Kavalagraha, Acharya is told in many places. He has even explained for many problems in Uttarasthanam, Ashtanghride Uttarasthanam, if I'm not wrong, in the 22nd chapter, uh, wherever the patient has weak teeth, when the patient has mukapakam, stomatitis, ulcers in this mouth, mukadushika, if there are some pimples. Now there are a lot of researches going on in acne, acne vulgaris, and pimples, how to treat them. Mukadushika is what is it's called as, and Gandusha or Kavalagraha will be an excellent treatment, and at the same time not a very time consuming one. You don't have to sit in one place to get it treated and all that. You can just hold the medicine in your mouth, keep gargling it, and keep walking around. So I feel Gandusha is a great way of treating even acne, acne vulgaris, and so on. It also helps me to treat my patients in trigeminal neuralgia, in Mukha, that is in Trishna. There is a chapter called Trishna. Ayurveda says you are supposed to eat your food when you feel hungry. You have to make sure that you get hunger at the right time. But Ayurveda never says that you have to wait for your thirst. Thirst is considered as a disease in Ayurveda. So before the thirst arises, it is better to drink water and keep it that way. That's what Ayurveda suggests. So Mukha Sosham, if there is a dryness in the mouth, then yes, Gandusha will help a lot. Glossitis, if there is some inflammation of the tongue, it helps well. Even for the diseases of eyes, other diseases of the ears, teeth, gums, tongue, the throat, recurrent throat infections, vocal cord nodules, and so on. And if there are some problems with the buccal mucosa, sometimes there is a thickening. People, when they start biting the food, they bite their buccal mucosa instead of the food. One of my patients who's taking some antidepressants for quite some time now, she's been having a thick buccal mucosa where she keeps on biting her inner cheek. That because of the that is a side effect of the medicine. The buccal mucosa gets thickened. So Gandusha Kavalagraha helps excellently in those cases. Sinusitis, pansinusitis, maxillary sinusitis, and frontal sinusitis, especially in these cases, Kavala Gandusha Graham is very, very good. Then comes migraine. Then all many problems of the neck and shoulders, even halitosis when the patient has some bad breath from the mouth. We consider it as pitham in the gut, which is creating the bad smell. And also, even if the patient has a continuous drowsiness and so on, this Gandusha and Kavalagraha can be given. Gandusha is when you hold the whole mouth with medicine, while Kavalagraham is you have only you have the buccal cavity, the mouth filled partially with medicine, and you can keep gargling it. Basically, if it is a vataja problem, then you can give some ghee medicine or a thaila medicine. Most of you must be knowing about tila gandusham, that is gingerly oil or a sesame oil, oil pulling. And then other than that, we give honey gandusham. We give different types of ghees for gandusham. We give kashayas for gandusham. That is, if it is a pittaja problem, then a ghee one. Even in vataja problem, we give ghee, and in kafaja problem, we give a honey-based medicine, and even kashayas are used for gandusha and kavalagraha. Especially at times when the patient has some coating in the mouth, they go to the dentist to get it cleaned and so on. We give gomutra gandusha. We take fresh gomutra. Usually, what we call fresh is you can keep it for 3 days. You can refrigerate it and keep it for 3 days because the patient cannot go and collect the gomutra daily. So it can be refrigerated for 3 days and maybe 20 or 30 ml per day for 5 to 10 minutes of Kavalagraha or Gandusha, we advise. Other than that, the medicine will be sometimes cold. When the cold means, it doesn't mean that you have to refrigerate it. Cold is you store it in a pot or something like that. Uh, so cold medicine or a warm medicine or a hot medicine is given to for Kavala and Gandushagraha depending upon which dosha is present. I mean, if there is too much of inflammation of the tongue and so on, we don't go for a uh, very hot one or a very cold one. A warm one will be very soothing. While if there is a stomatitis, then a cold one, even a ghee without melting it, will be actually a very good option. For example, a most recent case that we have done is a continuous stomatitis problem. She's having she's around 50 years old, I believe. Uh, she is a diabetic patient and she has inflammatory bowel disease. And because of this inflammatory bowel disease, she keeps on getting stomatitis in her mouth, and we have given her Indugandham Ghrutam just for Kavalam. That is, she will keep gargling it. In a day, I've advised her to take it 2 to 3 times, and the very first day she felt more than 70 to 80% of relief. So this is the first question. Next comes the tongue analysis. See, I'm not a very proficient person when it comes to tongue analysis. People say that you can look at the tongue and look at all. I mean, it will be like a mirror of the whole body. This is what people say. But I can tell you what I do. Although there are some doctors who can see the tongue and diagnose many diseases, and they say that it reveals the state of the inner organs when you see look at the surface. However, When there is a white color coated tongue, it should be a kapha problem. So when it is a kapha problem, you have to go for you have to look at the kapha sthanas for the problem. So you know that there are five types of kapha, five types of pitta, and five types of vata, and you also know the basic sthanas of kapha. So, for example, urasthanam is the vishesha sthanam of kapha, right? And there is avalambaka kafam, kledaka kafam, bodhaka kafam, tarpaka kafam, and sleshaka kafam. Each of these kavas have been given specific sthanas and specific karmas. So when you see a white coated tongue, you have to ask questions from these sthanas. Whether do you have any problem in the throat, or do you have any problem in the, do you have headache or so on? Do you have some wheezing or so on? And even amashayam, that the stomach is also a part of kapha and pitta both. So you can also ask questions about their hunger and so on. This is why when a patient loses his or her hunger, they get white coated tongue. When they are not very well digesting, when the metabolism is not very good, their tongue becomes coated white in color. So you have to look at the kafasthanas if there is a white coating, and if there is a yellowish coating or sometimes greenish coating, you can see pitta or pittasthanas. And if it is a very dry tongue, then you have to look at vatasthanas. You have to look for the root of cause in the vatasthanas. This is what I generally do when I look at the tongue. And blue color tongue, black color tongue, and all are explained when it comes to vata, that is a severe degeneration. I have seen that only when I have attended some severe um, emergency cases. Very recently there was a suicide attempt which they wanted me to come and immediately resuscitate the patient. I guess we saw a blue colored tongue there. So in these kind of conditions, yes, we have seen, but in generally when in practice I have not seen uh, a, a bluish or a blackish tongue. We have seen yellow colored ones, sometimes even green colored ones, even though the patient has not taken any dyed foods, some green dye or yellow dye is not there in the food, still they get some kind of a coated tongue. Next comes pulse taking or nadi pariksha. Nadi pariksha in Ayurveda, they say there are three fingers that you can use, and karasya angushta mule he starts. That is the radial pulse that you take. You have to take maybe from the root of the thumb, you have to give two finger gap, and then you have to keep three fingers and see the first one becomes the kapha, pitta, and vata. Okay, the three fingers respectively. Yes, I do that a lot. For all the patients I see Nadi, I try to do Nadi Pariksha. But what has helped me in my long run is my father basically is a acupressure specialist. He taught me this Chinese medicine way of seeing nadi. That is, in the left hand, there are two nadis. One is a superficial nadi. Once you keep your hand, you keep your fingers and you slightly press, then you see a different type of nadi in all the three fingers. And then when you press deeply, then the pulse stops, and then you start slowly leaving it back. Then the pulse starts again. When this pulse starts again, that is a different type of nadi that you get. Basically, the superficial in the left hand of the patient, when you check, the superficial nadi will be of the small intestine, gallbladder, and the urinary bladder, while the deep ones in the left hand will be heart, liver, and kidney. And in the right hand, again, superficial will be large intestine, stomach, and something called as triple warmer. They call it a triple warmer. We call it tridosha, while the deep one has lung, spleen, and pericardium. See, if you see all these organs that they have given are actually koshtangas. You can go and see the 10 or 11 koshtangas that Charakacharya or Ashtanga Hridaya in Sutrasthana they say. For example, let me take liver and spleen. Liver and spleen are seen in the left hand deep palpation in the middle finger. and in the right hand, the spleen is seen in the middle finger deep palpation. Both liver and spleen are the Raktavaha Sroto Moolam. Yakrit Pliham, that is they are the two organs, that is the liver and spleen respectively. They are the Raktavaha Srotas Moolam. So when you see there is a, for example, Mukadoshika, we saw before, right? That is a pimple or some other skin disease which you feel is a Raktavaha Sroto Vikara. You can see the with the middle finger, you can see the superficial nadi and the deep nadi. If there is a decent amount of pulsation, then the nadi is good. If there is no pulsation, then there it means that the dosha or the dhatu kshaya is there. If it is very beating very fast and very with a lot of volume, then you have to understand that the dosha or the dhatu has undergone vriddhi or increase. Okay, basically, I feel this is a small introduction that I've given with the Nadi Pariksha. You need some a lot of practice, a lot of experience in this. I've been doing this since some 10, 11 years, so I have reached up to this point. Somebody has asked me again. Naomi has asked me about an 80-year-old patient who has lung fibrosis. We call it as urdhva shwasam. Please go and refer Shwasa Nidanam in Ashtanga Hridayam. Nidana Sthana Shwasa Nidanam. You will get Urdhva Shwasa. So basically, when you address diseases, it would be nice if we started addressing it as with the modern terminology initially, along with the Ayurvedic terminology, if you can find it. That will be actually very fine. There is Urdhva Shwasam, there is Chinna Shwasam, there is Mahati Shwasam. So I go with Urdhva Shwasam when it comes to lung fibrosis. Basically, the medicines that I'll give are Dashamula Katutrayam with Gorochanadi tablet, Dashamula Katutrayam Kashayam with Gorochanadi tablet. Then there is a specific this thing that I give, three churnas that I mix, Talisadi, Karpuradi and Rajanyadi. These three medicines I have successfully given in corona patients also. I have consumed myself too, and it works as an excellent preventive when it comes to corona. If you're not able to get a vaccine shot, until you get, this is an excellent preventive. Obviously, even after having all these things, you need to have your mask and social distancing and so on. Anyway, without digressing, I'll come back to the point. If you feel the patient has a pitta jashwasam, then you give the anupana, that is a mixture with these churnas. You can mix vidayadi ghritam or ordinary ghritam or ghee. If you feel it is a kapha problem which is creating the thing, then you have to mix it with honey. And I will also give Karpuradi Taila external application on the face, on the neck, the chest, and even the backside of the neck. Uh, and I will ask them to have a steaming with a small pipe attached to the steamer or the cooker that we have. And we will ask them to get steaming done after the applying the Karpuradi Tailam. I will also give Agastya Rasayanam or Dashamula Rasayanam depending upon the condition. This is just a general outlook. Many things will definitely differ. And while I'm asking them to take steam inhalation, I will ask them to take with Rasna Churna. These are the things that I can do. From the list, I feel if the patient is already suffering from Shwasam and if the patient's Agni is not very good, if the patient's hunger is not very good, then yes, definitely I will ask her to stop Ashwagandhi Legum, which she is already taking. I will change it into Churnam and I will ask her to take Ashwagandhi Churnam with milk. While we are talking, if you do not understand any technical jargon, please let me know. I'll be more than happy to answer the questions if they are small ones. Okay, or else we can have it in the at the last two, like how Sri Ramji mentioned. Okay, so I think the next one is uh, we are primarily taught single herbs and how to formulate them. Is it a common way of practice and prescribing herbal medicines in India, or is it mostly already made formulations? Both. We have both actually. Single herbs is one way of treating patients. Potensifying them with ghee or with oil or with water and making it into a kashayam, These all depends upon the condition. There is, for example, trifla. The trifla, same trifla used as churna will help us to get rid of constipation, while the same trifla, when it is used as ghritam, will help us in skin diseases, which is a kapha-based problem. And the same trifla in Thaila helps us in skin diseases, and when it is used as ghritam, it helps us in both skin diseases and in pittaja problems. So potensifying them is very important. Yes, I believe it's a very good thing to do. And single herbs are also, it's one of the easiest ways to treat people. But in India, when I treat, for example, when I treat in my clinic, I may be having some 30 to 40 single drugs. But as formulations, I will be maintaining anywhere between 900 to 1200 formulations. See, this is a clinic, I'm talking about a 53-year-old clinic. So, yes, these many medicines will be available. While practically speaking, I'm starting a new place at Madipakam, a different place. Now, that place, when I start, will have somewhere around 200 to 250 drugs only. And those are finished products. And single drugs, yes, I will always maintain anywhere between 30 to 40 drugs. We use both. Wherever there is single drugs are more than enough, when you know the Dravyagunam of the medicine, then yes. You know the Rasaguna Viri Vipakam, you know the Prabhavam. When you are able to directly give it for the this thing for the Rogam, then very well and good you can use single formulations. But acharyas themselves in Ashtanga Hridayam, Ashtanga Sangraham, Charak Samhita, Sushruta Samhita, they have mentioned a lot of multiple uh, drug-based formulations, right? That is to potensify them. So yes, we use both. Um Basically, it depends upon your practice. You will slowly, when your plethora of diseases that you treat, when it keeps increasing, you will have a different number of, an increased number of medicines in your clinic too. Hopefully, I have answered Naomi to her satisfaction. Next, Gemma Habibi, I think your questions, let me go through the question once again. Postnatal, prenatal, and child care. At Bharat Clinic, we have an excellent postnatal, prenatal, and child care. Although the whole system is geared towards modern system or allopathic system, or they would call it, or in India they call it the English system of medicine. Uh, well, this postnatal, prenatal, and child care are one of our specialities because basically we are infertility. This clinic is an infertility clinic and an arthritis clinic. So yes, we treat everything head to toe, but our specialty is this. Postnatal, prenatal, and child care is one of the most important. It's like a breadwinner for me. It's one of the most number of cases that we get here. We give no modern medicines. When I say modern medicines, we give no allopathic medicines, no chemical evidence-based medicine here. It's only Ayurvedic evidence-based medicines that we give. Okay, no allopathic medicines. So no modern medicines given throughout the pregnancy. Prenatal care, we give no medicine. We have even treated a case where there was she had 19 abortions. Every time there was a miscarriage or an abortion, and luckily, with God's grace, now she has a child. Then there was another lady some 4 5 years back who approached us. She now has two children, but before that she had three abortions. What we do is we have specific tailor-made bastis that we can give at home. The Panchkarma, instead of practicing in the clinic, we give a 100 ml syringe. We give the medicine to them. We ask them to take an enema. It is like cleansing their own body. Sometimes they will not be able to come to your clinic and get it done. Sometimes, in for example, in countries like US, it may not be allowed. In those kind of, even for patients in the US, we have suggested a daily vasti of maybe 20 ml, 30 ml, just to cleanse their body. There are different types of vastis that you can do. This is one of the types of vastis. And we also had another, one of our hallmark cases was, she had an accident, a road traffic accident during pregnancy, I believe in her fifth month starting. And immediately when she was going in a two-wheeler, she fell down, she rolled on the road, and it was a horrifying experience for her. And personally I know her, so it was very traumatizing even to hear what she was talking about. But however, we had to treat her. So we gave her this vasti only. Every month she had 8 days vasti, and she was given complete bed rest. But she did not come to us for the treatment until she went to a modern doctor. First, she went to a modern doctor, and the doctor said, everything is fine. You don't have to undergo any treatment. You just have to take rest. But after 21 days, what happened was her uterus started opening from the inside. It is called as cervical funneling. If it was, there is only 3 centimeters of cervical length left out when there is a child inside in the womb, because the uterus is getting enlarged. The cervical length will be having almost 3 centimeters to 4 centimeters length. She was having 1.7 centimeters length, and from the inside, 1.3 centimeters was open. And she was to undergo an emergency encirclage. She underwent that. But after that, whatever treatment, whatever tablets were given to her, including progesterone tablets and so on, she did not consume even one single tablet. We put her in complete Ayurvedic treatment. I went to her house, I treated her continuously for 4 months. And now she had the first child was also a normal birth, and she has a second child now that is also a normal delivery. So basically, Ayurveda, once it treats, it stays treated. So this is one of our excellent area of if I may call it so, my expertise. And the other question is about multiple sclerosis. Yes, we treat a lot of multiple sclerosis cases, scleroderma case. Recently, we have done a scleroderma case where I've given Brahmivati with gold, ashwagandha. I have also given her Brahmana Vasti. I have asked her to take Vasti at home with Brahmi Ghrutam and so on. Excellent results are there. And then where in the areas of dryness, for example, in this case, it was in the thumb, I believe in the right hand's thumb. It started to get very thickened. It's not very soft because of the sclerosis, the scleroderma. And we asked her to keep a pichu, a simple one, Dhanvantram Tailam with Sahasradi Tailam. We asked her to keep a pichu. Pichu is something you tie, you soak the uh, cloth in oil and you just tie it around the area. That is called pichu. We asked her to keep pichu for some 6 months to 1 year continuously, and that the dryness, the scleroderma in the hand actually vanished. That was one of the hallmark cases. So, coming to the other questions, so fibromyalgia, yes, fibromyalgia, especially when it comes to fibroadenomas and fibromyalgias, we give at in clinic we give kashaya daras. Excuse me. Kashaya daras, we give dashamola kashaya daram. That is, we make 5 liters, 6 liters of kashaya, and we ask the patient to bathe in it. Um if you are not having a panchakarma set up there, what you can do is you can ask the patient to have a big basin or a big tub in which she or he can stand and or sit, and then just take the kashayam and pour on themselves. It's an easy way to do. There are small ways, creative ways in which you can do the same treatment at home. You don't have to have a panchakarma setup. In many conditions, in Vasti you can do this, in Virechanam you can do this, in Vamanam you can ask the patient, you can guide the patient to do Vamanam at home. You can do this Kashaya Dara at home. There are many treatments that you can do at home, even when you don't have a Panchakarma setup or you're not allowed. Cancer is a very next topic is cancer. It's a very vast uh, area, I believe. Uh, Basically, treating cancers with just Ayurveda. is definitely a challenge. Treating cancer with just modern medicine is also a great challenge. Right now, I believe I have two cancer patients, and I also had a precancerous patient and endometriosis patient. The endometriosis patient is now cured. She does not have any pain. She does not have any this thing. She used to have whenever there is monthly menses, whenever there is bleeding, she used to have severe cramping pain, and in a month, after the periods, after the menses, she will be without pain for maybe a week or so. That's all. After that, she will have pain continuously. That is, in a month, she suffers for more than 20 days with pain. We have treated her, that is a precancerous stage and endometriosis stage with adenomyosis. Precancerous stages are very easy to treat in many conditions, especially when it comes to the uterus. And another precancerous stage, now we are treating a case with sthanakilaka. In the breast, she has severe blockage in her ducts. Because in her fifth month of pregnancy, I believe she underwent an abortion, and because of the abortion, the body works like a clockwork. After 4 months, she should have been lactating, and now her body is lactating, but the child is not there. So this thing is getting collected, and it is creating a problem. We have given her virachanam, and we have given her. I've also suggested her kashaya dara. Dara is pouring medicated oil or medicated decoction all over the body. While she has not yet turned up for the Panchakarma, yes, medicines have been given to her. Cancer, I've also been treating one prostatic cancer patient post surgery. We have to make sure that his prostate specific antigen should not go beyond zero point 0.1. It was at zero point 0.6, I believe. Slowly after the treatment, it has come to 0.26, and I definitely believe it will also come down further. Um, so this is what cancer is a very vast area. So I'm only going to talk about my experiences where I am done and where I'm not done. I'm not going to talk about what I've not done. Basti, yes, Basti is next question is about Basti. Uh, Again, Basti has different plethora of Vastis are there. There is Matra Vasti, there is Kashaya Vasti, then there is Arohana Matra Vasti, where you increase the dose daily. Then there is Uttaravasti. In Uttaravasti, there is Arohana Uttaravasti. I think we need to have some 5, 6 classes just to understand the importance of Vasti. With Sriramji, I have shared one link of mine where I've talked about infertility. A medical, pharmaceutical company wanted me to talk about it. I would have given a glimpse of what is Vasti and Utravasti in that, and how I approach my fertility cases. That is one thing. So Vasti, we cannot talk here within 5, 6 minutes. Basically, I use a lot of Vastis, especially when it comes to knee joint pains, when it comes to fertility problems. I use a lot of Utravastis, Matravastis, and like how I told you, I give a 100 ml syringe. I ask the patient to warm the medicine and take Vasti by themselves at home when it is a Matravasti or a Brahmanavasti, 20, 30 ml, 50 ml, 60 ml. These kind of doses I ask them to take by themselves. That is Matravasti. That to oil or ghee based medicine only, where there is no complication, they can take it at home. And next, I think we have,
Sunita ji, you had a question? You're muted.
yes.
I have a question on Aroha Basti. Could you please expand a little bit on that?
Yeah, sure, sure. Excellent. Basically, a Matravasti, according to, let us take Chakradatta Acharya's book, because he has dealt vastly when it comes to uh, Arohana Matravasti. Basically, I go with Chakradatta when it comes to Bastis. I also use a little bit of Sharangadhar Samhita and Kaship Samhita, but I feel Chakradatta is very close to Ashtanga Hridayam, so I'm going to stick with that so that you all understand that. Arona Matra Basti is something that you can increase the dose daily. Chakradatta Acharya gives a specific dose, what you can use daily in this thing. He starts with 60 ml, I believe. There are three different doses that he gives for the first day. Usually, Vasti is told as Karma Vasti, Kala Vasti, and Yoga Vasti. Karma Vasti is for 32 days, Kala Vasti is for 16 days, while Yoga Vasti is for 8 days. There is a big a sukshma which is there inside this, that is eight. Why do they choose this word? This number eight is because there are saptadhatus, and the eighth one is ojas. So I'm going to share my screen here for a second. I'm going to show you one of the PPTs that I had. Hopefully you're able to see this. This Arohana Matravasti is what I call as Ascension Protocol Matravasti. Chakradatta Acharya says you can increase the dose by around 15 percentage daily without thinking anything about the holding time. You just keep increasing the dose daily. If you have given 100 ml today, increase it by 15 percentage tomorrow. If you have given 115 ml today on the second day, then again increase it by 15 percentage the next day. This is when the starting dose is at 60 ml. He has given two other formulas where the starting dose is at 90 ml and the other one is at the starting dose is at 120 ml. This starting dose, basically they decide this with what same formula they use for deciding the dose for Sneha Pana Matra. That is how much sneha a patient can drink in one day for getting a virachanam done or for getting a vamanam done. They use the same formula and they arrive at it. What happens is it is somewhere around 60 ml nowadays because the Agni is not very good. All over the world, the Agni is not very good. So it is better to stay with 60-65 ml. So what Acharya does is he increases the dose daily by 15 percentage, but you don't have to worry about the holding time. This was my PhD. What I did was I increased the dose by 25 percentage, but I took one sutram from Charakacharya, where he says the minimum holding time of Vasti should be 2 yamas, 6 hours. So if the patient is not holding the medicine for 2 yamas, then you should not increase the dose the next day. For example, if there are 8 days of Vasti, if you're giving 60 ml on the first day, and the second day, if the patient, the patient tells you that the Vasti was held for more than 6 hours, then you can increase the dose by 25 percentage. If you feel that the patient has not held it for more than 5 to 6 hours, then don't increase the dose. Give the same dose as the previous day. This is what I follow. What happens is the total average total dose also increases, and the average time of holding also is more than 6 hours, standardized one. So basically, the fecal matter, when it comes to the, why I've chosen the 6 hours is basically when the fecal matter comes, when it comes to the colon, it takes 6 to 7 hours. It comes in liquid form, and it takes 6 to 7 hours to get solidified. That is, it we keep on absorbing from it, and then at last it becomes fecal matter. That is what is not needed, and it comes out as a solid fecal matter, or shakrit as we call it. This is also the vatasthana. That is how God has given us. When it is a vatasthana, it absorbs most amount of moisture from that area, because vata is very dry. It absorbs most amount of moisture from that area. So we all know that we all know the Vatasthanas, right? So Pakwadhanam Visheshataha, we say. There are different places for Vata in the body, but all over Vata is present, but Visheshataha Pakwadhana, the Pakwashaya or the large intestine. This is where the most of the absorption happens at last. So when you give a liquid through the transrectal route, you also should allow it to stay there for 6 to 7 hours. This is the basic idea. That is what Charakacharya has also told. The Matravasti should be held for at least 2 yamas. So I take this as my ground rule to increase the dose. This, what happened is in 25 patients when we saw, The average total dose for 8 days was 1034 ml when we used Stanika Abhyanga also along with this Vasti. While when we did not use the Stanika Abhyanga, when only the medicine was given as Vasti, the total average dose for 8 days was 856 ml. But when you go with the normal Matravasti, where they give only 60 ml, daily only 60 ml is given. After 8 days, you'll be able to give what? Somewhere around 500 ml, 480 ml. So basically, I use this Arohana Matravasti. You will get this in Chakradatta uh, book. It's a very excellent book for you to practice Vastis and so on at home. You can prescribe Vastis at home to people. So this is what I wanted to share here. uh, this was erectile dysfunction treatment. However, the same thing holds good. Okay. Uh, uh, we have to look at the next question now.
Thank
Uh, where did I leave? I think we are at. I think I've answered Kema Habibi's questions here. Next one is Sherry's questions. I'm having a little bit of problem in.
Yeah, maybe if we can, Shri is not here, so maybe if we can move on to the next one after that.
Yeah, sure. So next one I think is Tejal Swami's questions.
Tejal, yeah,
Dose,
Tejal is here. Yeah.
dosage and the times to give patients herbs. Awesome question. I love this question because this is one of my specialities when I treat my student and when I teach my students. I tell them it is not important to even examine the patient sometimes, because when you see the patient you come to know what the problem is. But it is very very important for us uh, to do to understand how to give the medicines, because basically I'm a Roganidana person. Roganidhanam is pathology, Ayurvedic pathology. So I always love to teach how to give this medicine. I also have a slide for this from a different PPT, I think. See, Nidana Panchakam, everybody knows uh, Nidanam Pururupam Rupam, Upashaya, Samprapti, and Apti. That is, these things come together when it comes to treating a person. Nidana is the root cause. So you've asked me, let me go through the question once more. I don't want to digress. Uh, Dosage and times to give the patients herbs. Basically, when the patient comes to you, I'll try to keep this very short. This one slide alone will take somewhere around 1 hour to me for to explain, but I'll try to keep it under 2 to 3 minutes. When a patient comes to you, this holds good for all the patients. I This is my style of treating patients. Okay, so when the patient comes to you, you look at the nidanam first. When you know the reason, then you know which guna is increased in the Vimshati gunas. When you know which of the Vimshati gunas is increased, you know which opposite guna to give as treatment. That is, for example, in SGV is Sandhigata Vatam. If there is Sandhigata Vatam in the knees, if the patient is having pain in the knees because of dryness, that is because of Vatam, then Ruksha, Laghu, and Khara Bhavam has increased. Then you are supposed to give Snigdha, Guru, and Slakshna Bhavas as the treatment. This is where single drugs come in. Directly when the single drugs Guna, Rasa, Guna, Virya, Vipaka, and Prabhava, right? So in Rasa, you need to take Madhura Rasa, Amla Rasa, and Lavana Rasa also a little bit. Uh, where there is the drug should have Madhura, Amla, and Lavana Rasas, and it should have Snigdha, Guru, and Slakshna Guna. When you take it this way and you start giving them this medicine, for example, like ashwagandha, okay, because ashwagandha is a very well known medicine, so I'm talking about ashwagandha. So you can give this. You also have to take into consideration with which vata is increased. Vyana vayu is definitely increased, right? Because vyano hridistitaha krishna dehachari mahajavaha gati apakshepana ukshepana nimesha unmeshanadikaha. That is, even the smallest movement like nimesha and unmesha, closing and opening of the eyes, and gati and apakshepana, even a largest movement of the body like walking or jogging, and apakshepana, ukshepana, that is flexion and extension of the uh, joints. So the largest of the movements in the body and the smallest of movements of the body are all uh, connected to Vyana Vayu. So when a joint problem is there, definitely Vyana Vayu is there. And in this case, what we are talking about, Sandhigata Vata in the knees, Apana Vayu is definitely there. Apano Apanagaha, Shroni Vasti Medra Uru Gocharaha, Shroni, Vasti, Medra, and Uru. When he says that is anywhere below the Navi, when there is problem, you have to take it as Apanasthana. Shukra Artava Shakrit Mutra Garbha Nishkramana Kriya, he says. That is the karma. When the sthana, when we take the sthana, that is below the navel, it is Apanavayu sthana. And these two Vayus are affected, and the Shleshaka Kapha is in the Sandhi only. So the Shleshaka Kapha will also be treated. Here Shleshaka Kapha decrease, Kshayam is there, and Vyana Apanavayu increase is there. So we will have to increase the Kapham and decrease the Vayu. Very simple. So when the Nidana, when you find out the Nidana, you know the Guna. When you know the Guna, you know the Dosha. That is, we all know that each dosha has its own gunas, right? For example, Vayu has Tatra Ruksha, Lagu, Shita, Khara, Sukshma, Chalo, Anilaha. Okay, all these 6 gunas. When these gunas are increased, you give the opposite gunas, just like how we taught, we saw, no? Snigdha Guru and Slakshana gunas will be given. So when you know the Nidana, you know the dosha. So the medicine will be selected for the dosha. Single drug or a formulation will be selected for the dosham or the guna that is increased or decreased. If it is increased, the medicine should decrease it. If it is decreased, then the medicine should increase it and bring about a equivalence. So I'm not going to talk about Pura Rupa and Rupa. It might a little bit confuse you. I'm going to go to the next stage. So when we know the medicine is for the Nidanam or for the Dosham, then the Aushadha Kala, there are 10 Aushadha Kalas told by Ashtanga Hridayakara, while 11 Aushadha Kalas are told by Ashtanga Sangrahakara. So you can take whichever you feel is fine. But if you see Aushadha Kalam, basically the explanation is given to only Vata. 1 or 2 places Acharya has talked about Kapha and Pitta. Other than that, everything else is for Vata. Apanavayu Aushadakala, Pranavayu Aushadakala, Udanavayu Aushadakala, Samanavayu Aushadakala. That is, when you know that, for example, this is a Apanavayu Aushadakala, right? Because the Sthanam is in the Apanasthanam. So the Aushadakalam will be for the Apanasthana. That is, when you want more bioavailability of the medicine in a specific part of the body, then you see, for example, in this case, it is Apanavayu Sthana, then you use Apanavayu Aushadakala. If you want to give medicine for the heart, then you will give Vyanavayu Aushadakala or Udanavayu Aushadakala. Urahasthana Udanasya. When you want to give medicine to the brain, when you want to increase the intellect, when you want to increase the memory, you will be giving Pranavayu Aushadakala. The basic reason for giving this only Vayu is given the most importance in Aushadha Kalam is because Pittam Pangu, Kafam Pangu, Pangavascha Maladatavaha, Vayuna, Yatra Niyante, where they are pulled by Vayu, Tatra Gachanti Mekavat. Like the uh, Mekha or the
Clouds.
clouds which are being pushed by Vayu, and they pour their water as rain in a specific place. The same way, Pittam, Kavam, and all the Rasadi Dhatus, Rasrakta, Mamsa, Medosti, Majja, Shukra, all these Dhatus cannot move at all without the help of Vayu. If nothing can move, then Rasadhatu also cannot move. If whatever medicine or food you take gets mixed with the Rasadhatu and Raksadhatu and it goes throughout all over the body. So Vata is the one which takes the medicine also all over the body and it gives. So it would only be apt to say which Vata is giving the medicine where. Apanavayu gives the medicine below the Nabi. Samanavayu gives the medicine in and around the stomach. Udanavayu gives in and around the chest, while Pranavayu gives it for the Murda in the head, and Vyanavayu gives it all over the body. So if you have, for example, a Jwaram, Then you have to take Vyanavayu Aushadakalam and Samanavayu Aushadakalam, because Vyanavayu is Jwara is felt all over the body, right? The temperature is felt all over the body, the Vegam is felt all over the body, and at the same time, Samanavayu is also affected because the Agni from the stomach is being pushed out, and that Agni is what is creating the Jwaram all over the body. So you will use two Aushadakalas. So it will only be apt to use the specific site. You have to look at the site of the problem. First, the medicine was decided based on the dosha, but the Aushadha Kala, when to give the medicine, before food or after food or during food or with food, mixed with food, or in between two bolus of food. One bolus of food you take, one bolus of medicine, one bolus of food and one bolus of medicine. There are many types of Aushadha Kalas that you can give. And then there is Muhurmuhu. When patient comes with cough to you ask them to mix the medicine, keep with them, and keep on taking it half an hour once or 1 hour once, maybe a small amount. That is called as muhurmuhu. In kasham, shwasam, and all, you can do that. So, selecting the medicine based upon dosha, while the time of the dosage will be based on the Aushadha Kala, and the Aushadha Kala is based on the site of the problem. This is how you're supposed. This is a basic sutram, a basic idea, formula that I've given you. For each case, you can build upon this, or you can ask me doubts, no problem. Next comes autism. Autism, again, as I told you, it is one of the ADHD problems, attention deficit hyperactivity disorder, autism. This is bread and butter for Ayurveda. I usually use Swarna Prashanam. I have my own friends who prepare Swarna Prashanam. They are GMP certified medicines. That is, Suvarna Basma is mixed with some other medicines like Brahmi and so on, and then we give them in Pusha Nakshatra. Especially when there is Pusha Nakshatra, we ask them to take that every month. Or in some cases, when the ADHD or autism is very high, we ask them to take the medicine daily for 3 months. Then we give a gap, and then we give again for 3 months. Excellent results are there. I have some testimonials from my patients also, where the children have become normal after administering Ayurvedic drugs. Not only the Swarna Prashanam, there is something called a Suvarna Vacha, where a traditional family from Bangalore makes it. They take Vacha stick and then they drill a hole in that, maybe a 1 millimeter hole, and then they insert a gold filament into that without breaking the Vacha stick. When you drill to a depth of 5-6 inches and you're able to insert a gold filament, you need to have some kind of knowledge about it without breaking it. So they have this parampara of doing this. Generations they have been doing this, I believe. That also we buy from them and we give. There are many other medicines like Shankapushpi, there is Brahmi, single medicines like Brahmi. In Tamil, we call Vallare Kirai. It is a spinach kind of thing that we get here. Then there are many other patent medicines also available. Autism is one of the most important things, easily treatable also. It takes some time, but definitely the child sees a lot of results with Ayurveda. I also give a lot of vastis when it comes to children. I teach the parents how to do the vasti. Depending upon the age, a 5 ml dose or a 10 ml dose or a 15 ml dose is given for the children. Daily they can give vasti at home. Constipation. Next question is about constipation by Tejal ji. So constipation again, it is Apanavaya Sthanagata problem because Shukra, Artava, Shakrit, Mutra, Garbha Nishkramana Kriya, all these things are pushed out by Apanavayu. So when there is a problem with constipation, then it is an Apanavayu Sthanagata problem. This constipation can be or may not be associated with the bleeding. That is, there can be anal fissure or there can be a piles which is combined with this constipation. Sometimes there is only constipation. Again, in constipation, two doshas can be there. One is because of kapha, where there is a sticky motion which is not allowing the motion to come out. There you have to dry up the uh, fecal matter. While there is another one is most of the people suffer from a very dry motion. There you have to give vastis and so on. Okay, you can give vastis. If you are not able to give vasti, medicines are always available. The same medicine, for example, Gandharvastadi Taila. Gandharvastha Thailam is the what is that? Velakanna we call in Tamil. Castor oil. The
Castor oil.
same castor, yeah, the same castor oil can be taken 2 teaspoons at night before going to bed. Will relieve constipation if it is a vata base. But castor oil has a tendency not to increase the pitta much, and at the same time, it will decrease both vayu and kapha. So even if it is a sticky motion because of kapha or a dry motion because of vata, administering castor oil is a very good way of relieving constipation. I also use other medicines like Triphala, Avipatti Churnam, Trivrit Lehyam, and so on. And if it is a habitual constipation or if it's an obstinate constipation since years together, where the patient passes motion only 2 to 3 days once, then it is better to give a virechana. Virechana is a purgation where the patient will pass liquid motions 5 to 6 times a day. There again, the same Gandharvastha Aditaila or the castor oil can be used depending upon the per kg body weight. In all adults above 60 kgs of weight, we give a starting dose of 50 to 60 ml of Gandharvastha Aditaila in one shot. So that day they will keep purging. We also have other medicines like Trivit Legium. I told you they can take 20 or 30 grams of Trivit Legium and they will start purging. So this every 6 months once this can be given. Vasante Vamanam, in Vasanta Ritu you can give Vamanam, not for constipation. I'm just talking about it. Sharadi Virechana. In Sharad Ritu you can give Virechana, that is in autumn season, and Pravrishi Vastihi, just before the uh, rainy season when there is a Pravrit Ritu. In that Ritu you are supposed to give Vasti. This is for a general health of the person. This is not for treating. So if you want the patient to be relieved of constipation, every autumn season he or she has to take a Virechana. Then what to do during pregnancy? During pregnancy, there are specific chapters when it comes to pregnancy. Masanu Masika Garbini Paricharya. Again, it's a big one. Like how I told you, the basic things that we advise are milk, ghee. These two things we ask the patient to take every single day in large quantities. 3 to 4 glasses of milk, somewhere around 800 to 1 liter of 800 ml to 1 liter of milk, and 12 to 18 teaspoons of melted cow's ghee with freshly prepared hot food. Depending upon in which month she is, we slowly increase this dose. Initially, we start with 1 or 2 glasses of milk, we end up with 4 glasses of milk, and so on. So Masana Masika Garbini Paricharya, we also give vastis if it is very necessary, or else we don't give vastis. I told you, right? A case where we treated, she fell down from the bike in her 5th month. We treated that case too very successfully. So, Masanumasika Garbini Paricharya is usually, I think you have to go through that once for you to ask me doubts. That will be easier for me to, answer.
What's the role
Uh,
of Aragvada? Sorry. What is the role of
yes,
Aragvada in constipation?
role of Aragvada. Basically, Aragvada is used as a Kafahara drug. Aragvada can be used either as a single drug like a churnam or as a kashayam when it comes to Aragvada kashaya. If you want to decrease both kapha and pitta, there is a specific formulation called Aragvada Amrutadi kashayam. And Aragvada Asavam is also available when you want to treat Vata Kafaja disorder. So basically, Aragvada will reduce the kapha nature, the sticky nature of the motion. Uh, Personally speaking, if you ask me, rather than giving Aragvada, I will suggest Trifla, which is a far easier thing to give.
I
But yes,
Dr.
please.
I have a patient who doesn't respond to Triphala. So
Okay.
she has tried all different kinds, the capsules and the churna and many ways. And I have increased the dosage also, but she
Okay.
doesn't respond to it. So what is the alternative to that?
Excellent. One thing that I see in my patients generally is they take this triphala very early at night. That is, after their dinner, please see whether they have given 3 hours of gap before taking the laxative medicine. if they don't give that 3 hours gap, what happens is the triphala by itself will create constipation. Not only triphala, it can be a trivrit, it can be a gandharvastadi or anything, because vayo, aho, ratri, muktanam te anta madhya adikaha kramat. That is, vayu, pittam, and kafam are seen in the last part, in the middle part, and in the first part, respectively, of Vayas, during the day, during the night, and after having food. So immediately after having food, kapha is increased. When the kapha is increased, you give a medicine like Triphala, or you give Gandharvastha Taila or Trivrit or Avibhatti Churna or whatever you suggest for decreasing the constipation. The medicine will end up reducing the kapha in the body rather than acting in the pitta. You have to give the medicine when the stomach is empty, not when the patient is hungry. When the stomach is empty, that is, the solid food takes 2.5 to 3 hours to pass from the stomach into the small intestine. It has to go into the grahani, it has to go pass through the duodenum and go. After that, if the laxative medicine is given, this is why we suggest an early dinner, suggest an early dinner by around 7 p.m. So the medicine can be taken by around 10:30 or 11 p.m., where some people will have other problems like gastric problems, gastritis, GERD, where they are not processing the food well. Their digestion will not happen within 2.5 to 3 hours. It might take 4 hours and so on. So, in those conditions, it is better to have an early dinner and have this medicine after 3 hours after their food, so that the kapha stage passes off and the pitta stage comes. At the pitta stage, if you are able to give the medicine, it works wonders. And this, I think, one point you can note. Other than Triphala, there are excellent medicine. Triphala is only a starting level of medicine when it comes to constipation, because it does not have any side effects, and it is a rasayana. Iyam rasayana vara Triphala, Acharya says. Out of all the rasayanas, Triphala is a rasayana vara, one of the best ones. Akshyamayapah, it cures the eye diseases. Ropani, it heals many ulcers in the body. Ropani, Twaggadam, even if there is a skin disease, you can give. So, Iyam Rasayana Vara Trifala, Akshyamayapah, Ropani, Twaggada, Kleda, Medo, Meha, Kapha, Asrajit. So, basically, when you feel the patient is having more Kapha and Pitta, he says Kapha Asra. Asra is blood, but blood in Ashray Baba, if you see, Pitta, if Pitta increases, immediately the Raktam will also increase. Wherever there is inflammation, there is Pittam. Wherever there is inflammation, there is Raktam also. So when you say a Kapha Asra condition, Pitta Trifla can be given, then it means in Kapha Pitta conditions, Trifla can be given. So basically, if you feel it is a Vata condition which is creating the problem, it is better to go for a sneham, a medicine like Gandharvastadi Tailam or Nimbamritadi Eranda Tailam, or you can give Mishraka Sneham. But be careful with Mishraka Sneham. Mishraka Sneham is a very strong medicine, even for Virechanam, even for purging the patient 5 to 10 times a day. We give not more than 1 to 2 teaspoons when it comes to Mishraka Sneham. So 4 to 6 drops of Mishraka Sneham might work wonders when it comes to these kind of patients. So if it is a Kapha Pitta patient, it is better to go with Triphala, because he clearly says, Acharya clearly says that Kapha Asra, in Kapha Asra conditions, it is very useful. So in Kapha Vata conditions, Gandharvastha Tailam is very useful. And the word in its Falashruti also in Gandharvastha Taila, the word Mala Shodhanaya is used. When there is a lot of Mala accumulated in the body, then for clearing that, you can use Gandharvastadi Tailam. When these two are not working very well, the best option is Mishraka Sneham. 5 to 6 drops of Mishraka Sneham, I think, should work wonders. Any other question regarding this, please?
That's all. Thank you.
Thank you. So next comes during pregnancy. I think we have talked about this. Netra Basti is the next question, and how long are we actually supposed to keep the ghee? Basically, it is for one muhurtam. Netra Basti is something. It is sometimes called as Netra Tarpanam or sometimes it is done as netra sekam. Okay, that is netra tarpanam is you build a small bridge around the eyes, or there are nowadays, there are molds available. You can keep the mold and just seal it with masha churnam. Uh, Masham is one type of dal where you can make paste out of it and you can seal it. Uh, you can keep the kashayam or the gridam or the thailam, whichever you feel, or even warm water inside the ice, inside the mold, and you allow it to, but it should always be warm. It should not be cold. You will keep on changing it, and so that it is kept warm. This is one thing that we do. This is also otherwise called as netra basti. Usually we do the treatment for 45 minutes, maximum of 1 hour. You cannot irritate the eye too much. And we ask the patient to come for the treatment in the early nights or in the late evenings, somewhere around 7:38 p.m. after they have had their dinner. Because once they do this treatment, it is better to keep their eyes closed, go home and just sleep off. We do most of our panchakarmas at an OPD based level. So yes, we asked the patient to come for the treatment, go home and just directly sleep. So for 48 minutes, you can administer netra sekam or netra tarpanam, or netra sekam is you keep pouring the medicine in the eyes. There is no bridge there. Then there is a netra tarpanam is you make a small bridge around the eyes and you fill it up with uh, the medicine that you choose. So you can do that for 45 minutes. Initially, you start with 15 minutes so that the eyes are not irritated. Daily, you can increase it by 5 to 10 minutes. Next, one Mr. Jeremy has asked about.
Anita, you're muted.
Sorry.
Is the masha same as the urad dal?
Yeah, exactly.
Urad dal.
Yeah, udad dal. You can make a paste with udad dal and you can put it around the this thing.
Thank
Uh, in our clinic, we don't use molds. We directly take the udad dal paste and we make a bridge around the eyes, and we do that. The same netrabasti is used as uh, uh, when it is given in the chest, it is given as uh, ura basti. Then hridaya basti, we also call it as hridaya basti. In problems of the back, we give kati basti. The
That's how
same way.
here. Yeah, that's
Yeah,
how done here. Yeah, with urad
yeah.
dal. Yeah.
Yes. Again, with the udad dal, around the lumbosacral area, we make a bridge, a circular one, and then we fill it up with oil. The
Yes.
same thing we do in the knees and so on. Uh, so a very effective treatment actually. Even we have reduced the eye power. That is, people come with myopia or hypermetropia, and we give Trifala Grita Netra Tarpanam or Netra Vasti, and the power of the eyes will reduce, and they can uh, throw their glasses away. They don't have to use the spectacles after that. It takes time, 5 to 6 months, but yes, we can definitely do it. Maybe 8 days or 10 days in a month will help. Next one comes. What is the next question? I think
Jeremy.
Jeremy is right. Before Jeremy, I think Susan has asked a question. Can you explain eye and tongue diagnosis? Like how I told you, I'm not a very proficient guy when it comes to tongue diagnosis. I only go by dosha. When according to the color and the complexion and the texture of the tongue, we can decide what type of dosha is increased, and then we can ask questions about the sthana. If it is a kapha problem, then I ask, when I see a white coating in the tongue, I ask questions about the kapha sthanas and so on. Eye diagnosis, again, looking at the eye, I can only diagnose what diseases are given by Acharya. I don't see the eye and decide everything about the whole body. That is not my way of diagnosis. So I think you are asking about that. Looking at the eye, which dosha or which dhatu is affected, that is a different area of expertise. That is not what I do here. Um, Next comes, the patient. Susan has asked about mid 30-year-old female has polycystic ovary syndrome. Super. And has hormonal issues she attributes to the PCOS. Can you explain she may have why she may have gotten them from the Ayurvedic Persecute. Okay, persecute and remedies. Can it go away completely? Yes, PCOD is one of the things that Ayurveda treats with ease, actually. Again, you have to, like how I told you, medicine will be selected for the dosham, while the Aushadha Kalam will be selected for the uh, place or the sthana. Okay, so this is again a Apanavayu sthana problem. When it is an Apanavayu sthana problem, like how Shukra Artava, Shakrit, Mutra, and Garbha Nishkaramana Kriya. So the Artava or the ovum has to come out from the ovary. Instead of one single ovum coming out, when there are too many ovums coming out, then it is called as, when there are too many cysts coming out, small cysts, it is called as PCOD or PCOS. When there are too many coming out, when the number is increased, small cysts and the number is very high, definitely it is Vayu. If you can see the general trend of how Vayu is explained, or the Vata problems are explained, you can see that it is a it's basically a number of lesions will be there and very small ones. Even in Kushtam and even in all other conditions, Vata problems will be small ones while the number will be very high. So this also should definitely come under PCOS, PCOD should come under Yoni Vyapat. Charaka Samhita Chikitsa Sthana 30th chapter, if I'm not wrong. Yoni Vyapat Chikitsa. Vimshatir Vyapado Yonir Jayate Dushta Bhojanat. Only because of Dushta Bhojana, eating the wrong food items creates all types of Yoni Vyapat. This is what Acharya very clearly says. Dosha dushta gata guhyam. This dosha and dushta, when you say dosha, vata pitta kapha, dushta is the dhatus which are getting problem because of the dosha. So this dosha and dushta both go to the guhya. Guhya is the reproductive organ. Trayo vimshatim amayan janayati. It creates more than 20 types of trayo vimshati, 23 types of uh, diseases in and around the pelvic area, he says. So based on this, you have to understand which dosha, which dhatu is affected. Definitely the Shukra dhatu is affected. When I say Shukra, it is common for both male and female. The dhatu, it's common. Their representations are different. It comes out as semen in men, while it comes out as ovum in women. That's all. Okay. So the representation may be different, but the dhatu is the same. Both the females and males have sapta dhatus. Rasa, Rakta, Mamsa, Meda, Asti, Majja, and Shukra. This Shukra Dhatu in women has a different representation. That's all. So again, it is Apanasthanam and it is a Artava problem or a Shukra Dhatu problem. Again, Apanasthanam and a Kapha Pitta problem. Basically, the dosha. While the Vayu is the one Tatra Gachanti Mekavatno. Pittam Pangu Kafam Pangu Pangavascha Maladatavaha. Vayuna etra niyante tatra gachanti mekala. The Vayu is also involved here. That is, the Apana Vayu is involved here. So, as the sthana affected is the apana sthana, other than the internal medicines, sthana gata medicines can be given. That is, if you are not allowed to do a Utravasti or something at the US, then what you can do is you can find some tampons from a medical store. You can use as easy as a Dhanvantram Thailam can be found from the net. Through the internet, you can order Dhanvantram Thailam or Dhanvantram Ghritam. Just soak the tampon in the warm liquid or the warm medicine. Ask the patient to insert it in her vagina and keep it for the whole night. Next day morning, she can throw it off. This is an excellent way of treating PCOS and PCOD other than the internal medicines you give. See, Panchakarma, when you're not able to, one person has asked me how to modify these Panchakarmas and take. This is how you are supposed to take. You can ask them to do it at home if it is allowed. I mean, I'm not, I don't know. I'm going to ask you all these questions whether Uttaravasti is allowed, whether Pichu is allowed. Uh, I basically feel when you are using a natural orifice and you are not intervening, there is no intervention. When there is no surgical intervention or a parasurgical intervention, I feel, I personally feel it should not be a problem, even legally. Even people who are not doctors advise these kind of treatments. naturopathy people, they advise these kind of, they are also doctors in India, but yes, they also advise these things. Uh, I have a lot of questions there. I will come back to that. That is again a confusing area for me. But this is one thing that you can ask the patient to do, dip the medicine, dip the tampon on the warm medicine and then ask them to use it. This I use almost right and left when it comes to this PCOS. And then you have to look at PCOS as in the Vyoni Vyapad, you have to take it as Vataki or whether it is Udavarta. In Vataki, I think you see Ruk, Toda, Ayama, Fenila, Aruna, Krishna, Alpa, Tanu, and Ruksha menstrual blood. That is, these associated symptoms have to be taken into consideration. PCOS, whether the patient is a lean patient, whether the patient is a fat patient, during menses, what are the symptoms that she has? Whether there is pain, what type of pain? Ruk is there, Shula is there, Toda is there. Toda is pricking type of pain. Ruk is a crushing type of pain. Shula is a mostly a twisting type of pain. Basically, Shula is told when it comes in the head and in the stomach only. Shula word is not used anywhere else. So when the Acharya says Shula, all over the abdomen when there is pain, he uses the word Shula. So Ruk, Toda, Ayama, very tired, and Fenila, the Arthava which comes out if it is frothy, and Aruna, if it is not very, if it's of very light red color, sometimes very dark color. Krishna, Alpa. Alpa is the amount is not enough. Per day, 75 ml to 100, 150 ml bleeding can be there if that is not there. And Tanu and Ruksha, if it is not very thick, if it is very, very thin, that it should have the thickness of the blood. If it does not have the thickness of the blood, it is Tanu. And Ruksha. Ruksha cannot be felt by touching. When the Arthava comes out, the patient will feel in her organ a type of a dryness. That is Ruksha. If all these things are seen along with the PCOS, you have to take it as a Vataki. If there is Vega Avarodha, the patient is stopping her Vegas, Veghanna Dharayet, right? You are not supposed to hold the natural urges. If the patient is holding her natural urges, because of that, if the problem has come, then that is Udavarta. Krichrat Vimunchati, Acharya says. That is the Artava comes out with difficulty, pain. With pain, it comes out like endometriosis, adenomyosis. In these kind of conditions also, the medicines that you select will be different. Basically, I use Dhanvantram Thailam, Dhanvantram Ghritam, and then I use mm, uh, Gugulutiktakam Ghritam in some cases. If there is an amenorrhea, I use Saptasaram Kashayam. And in young women who have PCOD, there can be underlying hyperinsulinemia. I think I have seen more than 100 cases of hyperinsulinemia when it comes to PCOD alone. In PCOD, hyperinsulinemia will be the problem. So when you treat the hyperinsulinemia, the PCOD will subside. This is one of the ideas I got from the modern medicine actually. They give metformin medicine for both PCOD kind of problems and in diabetes also. So there is no, you can also learn from the modern medicine. It's not that you cannot learn. The sutra formula can be learned from them. The medicine can be given in Ayurveda. In those conditions, I give Nisha Katakadi Kashayam, where hyperinsulinemia is there, along with Nisha Amalaki Churnam. There are other medicines also that you can give. Basically, I use these medicines. I think with more, uh, you know, discussions, we can arrive at a better medicine for the specific patient. And yes, it can go away completely. You have to keep telling the patient that they have to do Virechana or Vamana yearly once, depending upon whether it is Kafam. Then if it is Kapha, you have to give Vamana. If it is Pittam, then you have to give Virechana yearly once so that it does not come back. And a general massage also, a body massage they can take from either you or at home. They can take a body massage, maybe yearly twice or so, 2 3 days continuously.
Okay,
Dr. Bharatji, maybe we're at 8:30 in, sorry, 5:30 in West Coast. Maybe we can move to where you can ask some questions to them and start some interactions.
Okay.
Unless you have something to round off and complete, and then we can.
Yeah,
Sriram,
if anybody else has some
just one
question,
more
let me.
question.
Yes, Sunita ji.
I had a
Yeah,
question.
more question, please.
I'm sorry, it was, I don't know who was talking. Was it Laura or?
You.
Yes, I was talking.
Okay, first, Laura, why don't you go first and then Sunita ji can.
Okay. Namaste, Vaidya. I had a question about using certain dravyas to treat the PCOS. I've treated it once before, but I wanted to know, like, when we did our training and to become Ayurvedic practitioner, we were told if the cyst is more than 5 centimeters, to be careful treating it, and instead just give like prophylactic measures to prevent it from growing in the future. So I wanted to know your like thoughts on that, and also in terms of like dravyas, like maybe using like because for some women, like this PCOS, I feel like also, like you said, comes from insulin resistance, but in a way can also be like emotional distress triggered as well. So if you can speak more on like maybe what to do in terms of like media dravyas, as well as things to like, tikshna dravyas to like dilate and, puncture and drain and such things. So appreciate your help.
Awesome. Uh, Superb question, actually. When it comes to the stress-related hyperinsulinemia or stress-related PCOS, Medhya Dravyas will come into play. We give a lot of Saraswatarishtam, we give Shankapushpi, we give Brahmigritam, we give Panchagavya Kritam, both through the mouth, and also we give through Utravastis and Matravastis. While when it comes to 5 centimeters or more, you're talking about a cyst which is 5 centimeters or more. If it is a clear cyst, if it is a simple cyst and a clear cyst without septations, then it is very easy to treat, even if it is of 5 centimeters diameter. I don't think it is a problem to treat that. The first line of treatment, of course, here we give the first line of treatment will be Tikshna Virechana. That is, the patient should get more than 10 Vegas in a day. More than 10 times or 15 times, a maximum of 20 times, the patient can purge. The patient will be having 20 Vegas, Virechana Vegas in the same day. Basically, more than 10 is what we expect in a Tikshna Virechana. I would always suggest that as the first line of treatment. However, if that is not uh, allowed there, then you can go for, again, I told you, right? You can go for vaginal insertions with tampons, if that is allowed. Or why
We're
I'm
able,
not talking, yes,
we are
hello?
able to do that here.
Awesome. Then that is Panchakarma. You're already practicing
We
Panchakarma there.
can do Virechana as well. Of course, just needing to be like aware of like whether or not to do like mrudu or depending on their koshta. But I guess like to feel it out, right? Because every patient is different and can't just give like Kanchanara Gugulu for every single patient who has PCOS. So having to kind of gauge depending on what dravyas are best for them. So Tikshana and Lekaniya dravyas are best.
That I differ in that thing. I differ. Like how I told you, Tikshna and Lekaniya Dravyas will not work in all patients. Why it will not work is big. As I told you, you have to go through from the Nidana. If you are able to find out the Nidanam properly, uh, and if it is the Dushta Bhojana, if that is a wrong food that is creating the problem, then you will be with experience. Obviously, you need some, you need to see 30, 40, 50 patients, then you will know what questions to ask. So what will happen is, and it will be very specific to the place you are in, not the whole US. I'm talking about the local area, what kind of foods you have, what kind of variety of vegetables you have, what junk food is available in that area. Many things will come into play. So a Lekhaniya medicine or a Tikshna medicine might not work always. Like how I told you, I resort to more to Kashayam, Gridam, these two, and vaginal insertions along with the this like Virechanam, Tikshna Virechanam. When it comes to this, it is because most of the PCOD women, when they come to us, they are young women, unmarried women. We cannot go for Utravastis. Uh, so Utravasti is not ethically it is not allowed for unmarried women, so we don't do that. Of course, in some cases when we are it's when there is no other go. For example, we have treated one case. We are treating a case whose uterine agenesis case. The uterus is not developed at all in the child. She is now 16, 17 years old, and she has not been getting menses till we started to treat her. Till the age of 16, she did not get her menses. When they took an MRI, they did not see the uterus at all. After our treatment, now 8 millimeter uterine tissue is seen, and she is getting her menses every 15 days once, but only spotting is there. So, in the future, her vagina is not also fully developed. The first part is first one third is developed, the rest of the two third was not developed. Now, after the pichu, continuous pichu that we have given, vaginal insertions that we have given, two-thirds of the vagina is now grown well. Last one third is not grown. Once that vagina growth happens, then you have to put medicine inside the uterus. Even if she is an unmarried lady, even if she is a virgin, I'll have no other go but to put medicine inside the uterus so that the uterus grows. Or else we'll have to stop the treatment there if they feel it is ethically not good. So unless we are pushed not to do this, we also go for Utravasti. This is what I was trying to say. PCOS, Kanchanara Gugulu in all cases will not work out well. If it is a obese PCOS, if you feel the Meda Dhatu and the Kapha and the obesity is what is creating the problem, if you feel that is creating a avaranam or an obstruction, then you can go for Kanchanara Gugulu and other Tikshna Dravyas, Kshara Dravyas also you can go for. Otherwise, I find a lot of results with Dhanvantram Kashayam, Dhanvantram Kritam, Gugula Tikta Kritam, even Maharasnadi Kashayam or Maharasnadi Kada. Usually Maharasnadi is given in knee joint pains by most of the doctors even in India. But I use Maharasnadi as Kashayam or sometimes as Kada. Kada is a fermented Kashayam. It is neither a Asava Arishta nor is it a Kashayam. It is a fermented Kashayam. I use because it has more, little bit of more the Tikshna Bhava that you are expecting. But at the same time, it is highly Vata Shamana. As I told you, Vata Shamana medicines can be used when the number of lesions are more and they are small. So in PCOS, we go for this. And if the cyst is a simple cyst, if it does not have septations, oral medication, vaginal insertions are more than enough. So maybe initially, if it is a obese PCOS, you go definitely with a Virechanam and a Tikshna Virechanam at that. So initially, you train the patient with some low dose in the first month with 50-60 ml of Gandharva Thaila or something. And once she knows what she is going to undergo, in the second month, you can give a Tikshna Virechana with Trivrit or with Mishraka Sneham, or in here we have many other medicines, even Siddha medicines we use at times. Murukan Vidai Matre, one tablet is there, Murukan Vidai, we use that. So, depending upon the condition and the habituality, if the patient has undergone Virechana 2-3 times, then you can give a Tikshna Virechana to the patient. Initially itself, if you give a Tikshna Virechana to the patient, the first time in their life, if they are undergoing Virechana and you give Tikshna Virechana, that can create problems. The patient the gudam can get eroded, or it can lead to anal fissures, anal piles. It can lead to a weakness in the anal area where the patient will start losing this thing. I'm not trying to frighten you. What I'm trying to say is initially you go with the Mridu Virechanam first month. Second month, immediately you can go with the Tikshna Virechanam. That usually is a very good option. Hope I answered your question, Lara.
Right. Thank you so much, Vaidya. Appreciate it.
Thank
Namaste.
you.
I have
Namaste.
a question, please.
Sandeep.
Yes, please.
Could you please show some light on the bipolar and the how to actually initially deal with it? And then and then another question I have is the resuscitation in Ayurveda, as to is there any specific protocol for that, or how to deal with that in a emergency when we are there?
Basically, resuscitation. Let me answer the resuscitation first. I 100% follow the modern way of resuscitation.
Oh,
I
okay.
have not been trained in Ayurvedic way of resuscitation. When it come, I hope that you are asking about when the patient is unconscious,
Correct.
resuscitating them. This is what you're asking about.
Yes.
There is one condition where if the patient has a transient ischemic attack in the
Yes.
brain,
Mhm.
or if there is a brain stroke where the patient gets a paralysis,
Yeah, yeah, yes.
in those cases we do immediate resuscitation when the patient is breathing normally, when their pulse and heart rate are okay. If you have understood that it is a brain stroke which has created a pakshavadam or a ardhitam, that is half of the face or half of the body, when it is Hanti Paksham Ekam. That's what Acharya says. Hatvaika Pakshaha Marutam, he says. One half of the body is affected. So when the one half of the body, when it is affected, immediate resuscitation in those conditions we give with Shita Kashayam or Shita Takram. That is a cold, not a warm one. A cold takram along with the kashaya is mixed, and a shirodhara is immediately administered, where the patient's hemorrhage will be immediately controlled. We have seen doctors who have done this. We have also been treating paralysis cases right and left. So yes, in those kind of resuscitations, we are far, far, far better than the modern medicine, because in modern medicine they keep the patient in observation. They do an MRI and so on. They keep the patient for 1 or 2 days, and only then they start the medication. They don't start their blood thinners and so on, or other things that they want to do, because their own medicines can hurt the patient more. So they put the patient under in ICU and they just observe. They only treat the symptoms, whatever symptoms are seen. But while in Ayurveda, the resuscitation when it comes to brain stroke is awesome. We can definitely do that. While an unconscious patient, when the patient is not breathing, when something is stuck in the throat, when you feel that there is a sudden cardiac arrest and all that, modern way of resuscitation is far helpful.
Thank you.
Thank you. The other question was, Sunitaji's second question was?
The bipolar disorder and how to deal with it, or
Bi-
how to manage it.
Bipolar disorders, again, I think external panchakarmas are very helpful. Shirodhara is very helpful. We give Shiro Pichu, we give Shiro Abhyangam, whichever the patient feels comfortable with. And then we use Manasamitram Vati, Shankapushpi, and Shankapushpi is one of the very important medicines that we use. And then we use a lot of Brahmi with gold. Brahmi is a single drug along with gold basma we use. Uh, that comes as liquid, that comes as churnam, available in India. Uh, this is one thing. Other than this, I told you the Swarna Prashnam also we use in bipolar disorders, in ADHD, autism. Day to For a course of 3 months we give, then we give a gap of 30 days, and then we give 3 months again. This is one thing that we do. Uh, Plethora of medicines, actually. The repertoire is actually very big when it comes to Manasa problems. Again, you have to look at this. I will always come back to the same thing. Look at the Nidanam. If you know the Nidanam, you know the Dosham. If you know the Dosham, you know the Gunam. If you know the Gunam, you can give the opposite Guna as the medicine. When you are not able to go such deeply into that, then comes the superficial level of treating the patients. Initially I also did the same thing. When I finished my BAMS, immediately I was not able to formulate my own style of chikitsa and all. What I did was I look at the roga directly. I look at whether the vataja symptom or pittaja symptom or kaphaja symptom is seen. According to the symptom, I will look at the medicine. In the medicine, in the Falasruti, for example, Vidaryadi Gridam. Vidaryadi Gridam, Vidaryadi Rayam, Hridyo, Brahmano, Vatapittaha. It is good for the heart, it is good for putting on weight, and for Vata and Pitta conditions which are creating this heart problem and weight loss. And also in other conditions where there is Sosha, Gulma, Angamarda, Urdhva Shwasa Kasaharu Ganaha, where there is Kasa, Shwasa and other problems because of Vata Pitta, then you can give Vidarya Likrida. So this kind of mention, if it is there in the medicine, then I selected that medicine initially. Later, I was able to reposition these drugs with my own, this sutra that I've taught you, this formula that I've taught you. With this, I reposition that same Vidarya Gridam for many other things. I use it when the patient's speech is not good. When the patient is stammering, I use Vidaryadikritam. And then the same Vidaryadi Gridam is given as Nasyam. And Panchagavya Gridam, Brahmi Gridam is given as Nasyam when it comes to bipolar disorders. We use Jivantyadi Gridam when there is bipolar disorders as Nasyam and as internal medicine also.
Can we
So yes,
Vidarigandha Churanam as a tea as well, all day
yeah,
long?
definitely, definitely.
Okay, and the Gritam in nasal, and so it will have.
Whenever you give a tea, especially when you're trying to control the vayu, then you're supposed to add maybe 4 drops or 6 drops of ghee along with that. The anupana will be ghee. When you're trying to treat the pittam, so in Tamil we have a saying pittam has gone to the head. Okay, when the patient is having a unmadam or when the patient is having some kind of manasa problem, we say the pitta has gone to the head. So in those conditions, what you have to do is first definitely virechanam because the dosha gati is to the upwards direction. So you have to do a lower direction. This thing you have to give either a vamanam if the patient is not suitable for vamanam because the sthana is in the kavasthana. So if the patient is not suitable for vamanam, if the age is not suitable, if the patient is not a balavan, you cannot give vamanam. Then you go for virechanam. Second option is virechanam. So you'll give a virechanam where the dosha gati will be pulled, the dosha will be pulled downwards. Okay. So
Thank you
this
so
is one thing. After doing that, you can go for the Nasyam. Nasyam is very helpful in bipolar disorders.
Raji, I think you can start asking your questions.
Yeah. My first question is, uh, what kind of patients you receive in the US? What kind of patients you receive generally?
Most of
Because we can cater to that first initially, then we can increase your range of patients.
most of the time, patients have come after they have tried all the allopathic and even the or other alternative medicine like naturopathy, chiropractor, and all that, which is already uh, recognized by the American Medical Associations and also the FDA and all that, their treatment part of it and their urge part of it. So when they are frustrated and when they don't get anything out, I think that's when we get the patients. So they are really at the last phase that they have sought us.
So basically, when they are there, should be a range of diseases that you are treating.
Oh,
When
we get
people come, uh,
arthritis, we get
okay,
the Crohn's disease, ulcerative colitis. Um,
wow, hmm.
we get a lots of
Yeah,
that.
like all graha nirogas, everything having to do with anavaha shrotas, basically here in the US.
Yeah, because
There's so much
there is
Ayurveda.
so much of muck food that they are having, and some kind of food becomes a fad, and then everybody starts having it. So yeah, Annava Srota is, and also the allergies.
Yeah,
Um, Allergies, that these are the kind of patients I have come across.
I
okay.
can
So
also say,
uh,
like speaking off of my own practice, and I'm sure all of us can go around too and describe what patients mostly we deal with. I know Naomi has different patients, Gemma, Mira, all
Yeah,
of us,
exactly.
Sunita.
Yeah, go ahead.
But I have a lot of people coming to me for female health. So a lot of like yoni issues, a lot of like Artavava Shrotas issues, infertility, endometriosis, anything having to do with female health, a lot of it. And then, yeah, some arthritis, but mostly what I have seen like is women's health and a lot of, yeah, like stress related issues. Even we have such a high level of hypertension here and high cholesterol in the US. Um,
Fibromyalgia is another one. Yeah,
yeah,
Autoimmune.
autoimmune disorders.
Yeah, definitely.
stress.
Autoimmune,
Yeah,
pain, arthritis. I
yeah.
mean, pretty much
Osteoporosis
everything.
too.
By the
Stress.
time they come, they have a whole bunch of things going on with them because they
Yeah.
haven't been able to get help in Western medicine.
okay,
And they
okay.
come and they've already gone to acupuncturist, naturopath, and everything, and they're trying Ayurveda out.
Correct.
Acupuncture is recognized in the US.
Yeah.
Yes, it's licensed.
So we're not licensed. So that's kind of a lot of the medicines you were describing. We cannot
Yeah, they're not
use
available here.
some of them, and a lot of the treatments as well. So
So you're not able to use them. It's not allowed to use them, or it's not available. Like two different things.
So Vacha we cannot
Uh,
use, or did they change anything on that?
No, Vacha we can use.
No, the bhasma, any kind
Bala,
of is not.
Yeah,
But-
internally no bala.
Yeah.
Some basically all of the like all of the
You
metals.
cannot use bala.
internally no.
Sida cordifolia.
Cordifolia,
Bala,
no.
It has ephedrine and so
Oh.
they are very for
So we
the
just do external.
purposes.
Vacha
They
and
are
the
very-
bala.
And the Bosmas we definitely cannot use.
Yeah, we can't get any basmas, which is such a pity.
You
Bhasma,
cannot use what?
Bosmas.
Asma.
Basmas you cannot use.
Basma.
Oh,
Basmas.
okay.
bhasma.
Okay.
All of
Basma,
the rest is
you're
that's very
talking
specific.
you're talking about basmas that is metallic and mineral basmas.
Yes, we
Correct.
can
Right.
use any mineral or
So
like not
what-
minerals but metals.
What
yeah.
about if it is a guduchi sattvam? Guduchi is that you can use,
Yeah.
right? So those kind of basmas, trifala
Those are even
mashi.
hard to find though to be shipped here to the US.
Yeah, but then it's the availability of some of the formulations are very very concise. Actually, there are very number of them that are familiar and popular from the
That's
previous.
one of my questions actually. Good.
Yeah,
So
I
are the
think
ones
we use a few different like
very,
herbal
very
companies, but
accurate.
sometimes
We
even then there's
follow
ones that
our-
are hard to find.
we just want to follow our mentors, and the clinicians, and so I think that's have been in the practice. So there are many not been ordered. So
Exactly.
But
Yeah.
mostly everything from Kotakal, USA. We also have
Indians, Otakal, Dabur.
Do you have Aravind Herbals there? I heard that they have an outlet there.
can
I
buy
don't know
from
where in the
iHerb
US.
sometimes.
Aravind Herbals has a lot of single drugs that you can use.
But
It's
all of the
available in 50
single
grams.
like ekadravyas and churnas and stuff we
Yeah,
can
yeah.
get here. Like those are readily available even within Los Angeles area where most of us are based.
And then we have our director of Ayurveda, and with their help, they have this store called Atreya. So we ordered many things from them because I think that's a pretty good solid source of getting the organic food. So we don't have to worry about whether we are getting organic food for the patients or not. I mean herbs.
Herbs,
It
yeah,
is- and,
xylums and
And
mostly asavam we get from
also it's a very good outlet for us to mix our special I mean if I want to mix something this they will do it on our request, so it is
Oh.
not a one kind of a formula that is for all. If so if for our convenience, so if practitioners request them to make a special blend, they do that. So that there are many things available, but there are many things not available, and probably they have not been ordered before. So it's not a trend.
Okay. So basically, the medicines that are available are from Kotakal, from Aravind Herbal Labs, and the organic sources that you have.
Yeah,
We
bunny.
also can get Kerala Ayurveda, which is a lot of asavams, a lot of thylams, a lot of arishtams, lots of churnams, different preparations.
Asava Arishtas, is it allowed there in the US because it's an alcohol-based?
Yeah.
Rishtas are allowed.
Yeah.
Kashayams, rishtas are allowed. As some
Yeah, rishtas are available in Kotakal, USA itself.
yeah.
Mahodaya.
Oh,
Alcohol
great.
just has no problem.
It's legal here.
Okay.
It's the United
Okay.
States.
Okay, good. So we have to find a way to, if they have accepted acupuncture, if they have accepted other natural and so on, if they have accepted chiropractic methods, which are far simpler in my view. So we have to find a way for them to accept Ayurveda, right? That is where.
It works.
They've been trying for years. We're waiting.
Okay. Sometimes we have to talk in their own terms, or we have to find whether they don't want to accept. I mean, there is a part when they want to accept, and we can tell them why you have to accept it. When they don't want to accept it, I don't know how we are going to approach that. So now, what kind of panchakarmas are allowed? Your Vaman, Virechan,
I'll let Naomi take it away.
Only
Vaman
Vedic,
is not.
I think none of
Vedana and
The most practice in that area.
Sorry, Laura, can you repeat what you said?
I said I'll let Naomi answer that question because she's the one with the most Ayurvedic practice here, at least in terms of Panchakarma.
Yeah.
Oh,
so we can only pretty much do Videchana here. We can, well, insurance wise, so then it gets a little bit fuzzy because insurance will not cover even Netrabasti, for example, even Nasya.
insurance, for your information, I'm sorry, insurance does not cover Ayurvedic treatments in India. I mean, this is a pathetic situation in India.
Yeah, but
Insurance only covers internal medicines in India. Insurance does not cover Ayurvedic treatments unless it is done in a hospital setup, and that too only some insurance companies cover that. When maybe a handful of them. We have more than 100 companies giving medical insurances here. Not more than a handful of them give insurances which will cater the people for taking Ayurvedic Panchakarma treatments in a hospital setup. Not in a clinic setup. If you are in a clinic setup, definitely you don't get any insurance. Only they'll be allowed a specific amount each year, 15,000 rupees or 20,000 rupees, which I feel is a very meager amount when it comes to the whole family. Because if there are three people in the family, 5,000 rupees per person over a period of 12 months. That's not even 500 rupees per month. That is what is being allowed here in India. However, I would also like to hear about what happens in the US. So it becomes a little fuzzy when it comes to insurance. Okay.
Yeah, I was talking about malpractice insurance. So we can't, since we're not licensed, we cannot take insurance at all. So it's all cash based, pretty much. So
Okay.
people, then there's a barrier because only people who can afford it can receive it. But with malpractice insurance, we cannot do. Well, now they finally got us an insurance where we can mix the herbs and give them to clients, so that's good. But we can't do Netra, we can't do the Nasya. We could probably get away with giving people instructions to do Basti at home. But even then that's questionable if someone did, because America is a suing country. So if someone did sue us, it's kind of depends. Some of the things depend on our own risk. To provide the therapies, we highly recommend people to get massage therapy licenses as well, just so they're covered under massage. So, yeah, it's a bit limited here.
Yeah, I can understand.
So all the Abhyangas here are massage. I mean, you get your massage therapist before performing your Abhyangas?
That's what we recommend. I don't know for sure if people who are in practice are doing that or not. But it's definitely a risk that they're taking if they're not a massage therapist.
So just to understand, if they have a massage therapist license, they will be able to do all the external therapies. That is, we do massages with powders, we do massages with oils, we do massages with pastes. So all external therapies can be done, right?
Yes, it will be done in Ayurvedic way. But they have to have a license of the massage therapy. License.
So the Ayurvedic practitioner himself or herself have to do the treatment, or they can have a therapist to do their work for them?
They can have a therapist.
Because ours is not a degree, it's a practitioner 2 years. So we have to be a massage therapist also. If many people have done it, but we also cannot give the Abhyanga unless we are also massage therapist qualified. That's why that somebody.
So I'll understand it like this, and let me see if I can translate this, Bharatji, and Naomi, keep me honest here. It's not that they cannot do it without a massage therapist license. If they do it and somebody sues them, they're at greater risk of losing their house.
Yeah,
right?
I can understand that.
So it's not like they cannot do it, but if they do it without the therapy license, then that's greater risk.
So let me give a small suggestion here. For example, now I send medicines to almost all the countries in the world, but there is a problem with Korea. What happens is when it goes to South Korea, North Korea, you leave it. I mean, we feel it's not in the world at all. But when it comes to South Korea, when I send medicines, it has to be certified by a local doctor over there. I don't know how you will understand Ayurvedic medicines, but however, it has to be certified by a local doctor over there. So what happens if you have a video conference with an Indian doctor who is certified in Ayurveda and he suggests the treatments? What happens then? For example, if Bharat is going to consult for you in your place and he is going to give suggestions to the patients where he is a certified doctor, he is a PhD holder, he is a researcher, so he has some credentials. He is not bound by the US laws. So, what happens when he gives the instructions to the patients? Maybe when the patient comes to you, if I give the instruction, what happens then?
I think ultimately that it would still fall on us if something were to happen, because even now the way the laws are set up, we're technically not even supposed to do telehealth from state to state. So I'm technically shouldn't do a consultation with Shriram because he's in Florida. So I think it would still come to us even if you had given the suggestions.
Oh,
Yeah.
okay, okay. So,
So it depends on this, Dr. Bharatji. If Shri Rashi Incorporated in India is accepting money and treating a person, then you're completely outside of United States jurisdiction. But if Gurukula is accepting money, you're still treating him, they can still sue Gurukula.
Sorry.
For
Really
example,
sorry. I'm laughing at the laws, actually. I'm not laughing at this.
I know
I'm really sorry.
Yeah, you're just
Okay.
giving a suggestion, but it is coming, he's doing on your behalf, but he's the one who is implementing it. So he is in the picture.
So the entire legal system, it's very simple. It follows the money. I take money, a service is offered, I can be sued.
Yeah, exactly.
So what happens if you don't take money, you don't take consultation? What happens then? For example, you are giving a friendly advice, a doctor is there in India and he helps you to do the treatment.
Yeah,
You have
as
not
long as
taken
there
a
is no
single
paper
paisa.
trail, there is no problem.
Okay.
But if I've had a Zoom call and it's recorded, I'm done.
And they're recording everything nowadays. So
Yeah.
As long as there is no paper trail.
Okay. Okay.
So everything, money or no money is immaterial. Yeah. If there is a paper trail, you're liable to get sued. So that is why I think Naomi, Laura, Sunita ji, Meera, they're all saying there are only certain things we can do as a matter of how much risk that they can take in implementing treatments. That's the key thing. So mainly, if I understand this, there are certain medicines that are not obviously allowed here, like bhasmas.
But I see people selling basmas in the US. I saw some. I asked some of my friends. They have sent me links through the internet. They are selling even Swarna basma, Rajata basma,
Aloha.
Tamra basma, Loha basma.
Well,
They are selling those things in the US. How is that happening?
they're risk takers.
risk taking, they're
They are
taking risks.
Oh, okay. So even big players take that risk. That's what they do. Okay.
Unless they don't know the laws, but they probably do
They
know.
do, but they're taking risk.
There's also not such a huge regulation as like we're saying. There's no like big brother that we know of directly who is like watching over Ayurvedic practitioners and seeing whether wrong. You know what I
very
mean?
true.
Kind of like
The only time I would come back is if someone's sued or, there's articles online that Ayurvedic medicines have heavy metals. So if someone goes and gets a test and, they get sick, they get tested, then they say that they were taking Ayurvedic medicines, they would basically blame it on that medicine. Even if we already know everyone has heavy metal toxicity.
This is a general trend all over the world, even in India. This thing happens. I mean, they blame everything on Ayurveda.
Yeah. And the more natural it is, they can't benefit from it. That's another topic.
So basically, we have to stick to Kashtaushadi, that is from plants and things like that, right? What about animal products? What happens to animal products?
we don't really use.
For example, Panchagavya Gridam is taken from, except for the Go Mamsam, the Go Gridam, Go Kshiram, and then go mutram, and then go shanam. All these things are put together, and
I think there is some kind of restriction on that, because I remember Dr. Anu telling me that they took all of those out of their formulas out of Treya. So I think the FDA inspects, at least if you're selling it here. I don't know about if we ordered it from India, like who's going to know?
My patients who carry them personally by air, they don't have any problem. Even if I give 10 bottles of Panchagavya Ghritam,
they won't have a problem. No, that is,
But
that's not a problem. It's
if
only
I'm selling,
if a US organization sells in the US, then they assume a risk. That is all we are saying.
this is one problem, and but while, because I'm facing this problem from country to country, this thing differs, where there is a country which is flourishing because of its cattle, poultry, then for example New Zealand does not allow Panchagavya Ghritam to enter into their country. When it is something to do with cow, if they see the ingredients, cow's milk, they just throw it off. They don't ask even if they are bringing by air, sending Panchagavya Ghritam, because Panchagavya Ghritam is one of my most important medicines that I use right and left. So when I have to give Panchagavya Ghrita, let me be frank here. When I have to give Panchagavya Ghrita, I either have to mix some other medicine along with it and then rename it, so that in India it is allowed for Ayurvedic doctors to prepare their own medicines and give it to their own patients. So what I do is I formulate my own formula by mixing one or two medicines along with that. I give a name for that. I legally certify that, and then I get a certificate, and then I sell it. This is how we are supposed to do it when it goes to other countries. We make it legal and then we sell it. Of course, in the contents we have to mention the contents. That is always there. But then in those kind of things, it is allowed. A direct cow's product is not allowed in some countries. So that is what I wanted to know. So the FDA takes into consideration when it is a cow's ghee or cow's this thing also, right?
I'm not 100% sure, but I know they did. The company here that we use took those ingredients out. So maybe they were.
Okay. So can I get an ingredients list that your company actually follows, so that we'll be able to formulate what all things you will be able to practice there? Maybe we can increase the number of medicines that you use over there.
Sure. I don't know how to get the list from the company, but
Oh, okay. That is it. Okay.
I'll ask like Dr. Anu what we can't use and find out. Yeah.
But gritams are fine. All gritams are fine.
All gritams are fine.
Some of them have, the cow's urine in them. So for theirs, they took them out.
Right. If you're buying from Protocol, or maybe even there, or even from some other company, it's normally okay.
Yeah. They're not really, I mean, it's only if someone dies and then sues you that you're going to get in trouble, but they're not regulating it otherwise.
I mean, we don't know if the patient is going to die or not. Definitely not with Ayurveda. But if because of some other reason they die and then they start suing Ayurvedic people for that,
Exactly.
I mean, that becomes a big risk for us, right? Okay. So what happens to gritams, for example, like Amrita Prasha Gritam or Changeri Adi Gritam, where Haja Mamsam is used in the Gritam? Before I asked without Mamsam, what happens if Mamsa is directly used in the Gritam?
Jangala Mamsa, I don't think are allowed.
Sorry?
I said the like Jangala Mamsa and such things inside of them. I haven't seen them here in the US. I don't know. What about you, Gemma? You have also so much experience with all of the products too, and you work in Ayurvedic spa, so maybe you know too.
I do know of a lot of clients who have purchased the Panchagavya Gritam here, totally fine, and it's from Kotakal.
Okay.
I don't think we have access to Changeri Gritam here. Yeah.
So am I supposed to understand that with Mamsam, if some Gritam or any preparation is there, then we will be able to prescribe that?
Yeah, I think.
If it is available, we'll be able to prescribe. Okay, good.
I think so, yes.
Mamsam is a go. So yeah, sorry.
Sorry, can I add to the conditions everybody else mentioned? I've been seeing a lot of, especially Pitaja Arshas. So we can talk about those too.
Pittaja arshas.
Yeah. Well,
You,
arshas in general, but lately a lot of Pitaja arshas.
okay, lately you have been seeing a lot of Pittaja arshas.
Yeah.
Okay, you want to know some treatment for that, or
Yeah, we could talk about it, next time or whatever.
definitely?
Yeah.
Yeah, definitely. Pittaja arshas basically comes with a lot of bleeding, with a lot of inflammation, and also reddishness, and even with a small amount of pungent taste, or what we call in Tamil as karam. Even with a small amount of pungent taste, this arshas or the piles gets aggravated immediately. So definitely you have to go for medicines which are having chandanam in them. And then Pravalam, I think a coral, Basma is not allowed there. So if coral is not allowed there, then you cannot use that. You can use petals of rose. Gulkand is used. Petals of rose can be directly made into a kalkam, and you can give that. That is an awesome medicine. Then pomegranate and then papaya are excellent medicines for pittaja arshas or piles which is bleeding. And we also have other general pitta rechaka medicines. Definitely Trifala, Trivrit. Avipatti Churnam is one of the most important things that we use. Here in India, I use a lot of Pravala Prishti. I use Pravalam with Gulkand. That is an awesome medicine that I use. And then Abhayarishtam is one medicine. But in Pitta Jarshas, when you give Abhayarishtam, sometimes the bleeding never arrests because it is arishta based. Giving abhyarishtam might itself can induce bleeding. So you should go for the same abhaya, or you can go for that is haritaki and amla. Okay, haritaki and amla with leaving the vibhitaki out. Haritaki and amla can be mixed together and given as churna along with ghritam. Two single drugs along with any ghritam, whichever you feel. Even ordinary ghritam is fine. Or else you can choose a good ghritam like Dadimadi ghritam or Sukumaram ghritam. Gugulutikta ghritam works wonders in piles. Panchatikta ghrita, which is used in kushtam, Pittaja kushtam, works wonders in piles. In these things you can mix together and you can make your own formulation if you are allowed to do that. That is my next question. So if you're allowed to do that, you can mix these two churnas along with the ghritam, and then you can make your own Gemma Habibi's piles, solution. This you can do that. If that is allowed. That is
Yes,
my next question.
it
Is
is
that
allowed.
allowed?
Yes.
Yes, I think they said yes. Is that allowed?
Yeah, we can make our own formulas with single herbs.
Yeah.
Super.
There's
Then,
also bodies too.
so what happens is next question is that if I have 5 single drugs which I'm mixing with ghee or honey, if I have 3 single drugs which I'm mixing with ghee or honey or with any other thing, and I'm making it into a paste, and I give my own name for that, and I give it in the US, what happens? You have any this thing there? Because it becomes a multi-formulation, right? It's not a single drug anymore.
So I think as long as it's for your client, if it's directly for your client, yes, but and that's if you get this new insurance that they just proposed to us. But if you're doing your own labeling and then selling it to non-clients, we cannot do that. Apparently,
You don't have to sell it to your non-clients. What I'm asking is, even if you're not allowed to mix and give it to the patient, what happens if you are able to write 3 single drugs separately and ask the patient to mix it at home with ghee or honey, or whatever you suggest as Anupana? What happens then? Is that possible?
yes.
Yeah.
Then we can do wonders again. No, awesome. That's a good thing. We can take churnas. We can take the same thing as you're supposed to educate people there about kashayams, right? You can educate people. Homemade kashayams can be given. Packets can be made with the homemade kashaya churnas and single drug churnas. What you do is you start taking what I will look at easy kashayas where 3 to 4 drugs or maximum 6 drugs are available, 5 to 6. So what you can do is you can procure those single drugs and they can be available with you. See, there is a financial aspect also involved here, right? So definitely you can procure them, and when you prescribe them as your own medicine, you can ask the patient to prepare it at home, but you will be prescribing only the single drug. They can make either a ghritam or they can make a kashayam out of that medicine. They just have to spend, maybe for a kashayam they'll spend 10 minutes, for a ghritam they'll spend half an hour. They'll be able to make it at home. For example, pittaja arshas, which Gema was asking about, uh, bleeding piles. What we can do is we can take a bitter gourd, or we can take this haritaki alone, which is a tiktarasa drug, or we can take bitter gourd, or we can take pomegranate, and we can ask the patient to, for example, 1:4 or 1:3. It is available in Baishaji Kalpana. That is 300 grams of ghee and 100 grams of the drug can be added together and heated for a period of 30 minutes. Just allow it to cool, filter it and use that ghritam daily. So what happens is this, they can do it at their home. What formulation you are supposed to do it in your clinic and give it to them, the same single drugs can be given to them and they can make it happen. If they are an Ayurvedic enthusiast, and if the patient will do that, because in India most of the patients are, they are lazy. They want formulas which are completed. They want bottled formulas. I always tell them giving bottled formula should be the last option if there is no other, or if you are able to prepare the medicine at home daily, then there is nothing like that. So I think we can go with gritams and thylams, which you can prescribe it as single drug, while you can orally ask the patient to make the medicine at home. I think that is one of the things that you are already doing that, I assume.
Naomi,
Yes.
in the last insurance session, didn't we know that, I mean, instead of asking the patients, we can have and make it and give it to them, only to our patients, but not to the other. So we
So
don't have.
apparently, I think we weren't supposed to be doing that, even though I was and a lot of people were. So apparently we weren't supposed to be doing that. And now this new insurance that Cam
Yeah,
has offered,
yeah.
is
Now with the new insurance, I think we can make on our own and give it from ourselves to the patient, but not sell it outside.
right.
So we don't have to really ask the patients to do it. We can ourselves take those 5 or 6 the things that Dr. Bharath is saying. If we want to make those, amalgamate all of them
So
together, we can do it ourselves and
Yeah.
give it.
excellent.
Yeah.
Excellent. This is how I started my practice. I was instructed by my first guru, by my mother, that I should not use any patent medicine for the first 4 or 5 years of my practice. I never touched any finished products. I always was suggesting single drugs like these, or formulas which I study and I ask the patient to make at home and so on. So I started, telling people how to prepare these things and do it at home. So I think you should find out 5 Vata Shamana drugs, 5 Pitta Shamana drugs, 5 Kapha Shamana drugs, which are single drugs, which you will be able to, give it in permutation and combinations for the dosha. So you will actually be better Ayurvedic practitioners than many in India who directly give bottled kashayas. You will be true Ayurvedic practitioners actually if you are able to do that. If you then you can increase your number of medicines to, instead of 5 for Vata, you can have 7 or 8 medicines or 10 medicines. Pitta, you can have again 10 or 20 medicines. For Kapha, you can have whichever dosha is more over there. For example, you're talking about more cholesterol, more BP, and more food related problems. So kapha pitta problems are more. So you can go for more single drugs, and the permutation and combinations will happen based on the uh, panchavita vata pitta kaphas, and also based on their rasaguna virya vipaka. I think we should ponder upon this. One more thought on this. I always like thinking big. So, what about these insurance companies? What happens if an Ayurvedic doctor starts an insurance company? What will be the legalities? Why can't we start an insurance company?
Dr. Anu was talking about this one day, very briefly, if I remember now, Naomi. I don't know if you were there at that time. She was just mentioning about it, that I think the slowly it has to be coming from the Ayurvedic community, or
Exactly.
someone has to be brave enough to put everything together. But
Mm,
it's in
mm.
the air. We don't
Just
need.
money, I guess.
Yes.
Yeah.
There's, I don't think there's a legal barrier. So just
I
money.
think
uh,
everything
uh,
comes
uh.
down to money. So I think that's what it is. But people are very eager to do it, though. Yes.
Yeah. Because I always like to think, big. If there is some barrier that is restraining us, why don't we become that, so that we can, place ourselves out of our hurdles, so that
Sure.
that is one way I think about. Yeah, I think we should ponder upon that in the long run. Maybe in another the maximum of 3 to 5 years, we should be able to bring our own insurance policy, which will support the Ayurvedic practitioners. It can be a state-wise one, like how Naomi was talking about. It can be a state-wise one, right? For California, for Los Angeles. Okay, let us start as a small group. But I heard the word brave enough. Why are we supposed to be brave enough for that? Because of a legality issue?
Yeah, it's very litigated society, and
Um,
Mm,
yeah,
mm, mm.
sorry, I think people are starting to drop out. We are a little over time now. So I think
Yeah, even
let's
I am I am overtimed here, but I'm
yeah.
very
So let's
engrossed.
yeah, let's kind one second, Sunita.
one
So I wanted to one second, Sunita. So I wanted to kind of say that this is the beginning of sorts.
Yeah.
And we want to see if such interactions can become more and more in future. Naomi, if you can talk a little bit about maybe a potential mentorship program.
Yeah, well, we've just been discussing, so it just kind of came up organically when Sriram reached out to me to see, how we could potentially connect with this doctor in India. And so, it started out talking about it, some kind of online program. And I said, well, there's a lot of online programs on Ayurveda here, especially for the beginner level. But maybe I was being selfish, but I'm like, but what I would want, I need someone that I can ask one-on-one questions to at this point, because we learn so much in the program, but when we're in the program, we're not applying it really. I mean, we're in the clinic, but it's mostly the clinician that's doing everything. So when you get out of the program and you're actually seeing patients or clients, that's when you really need to understand this. And that's when we're kind of just left to, hopefully one of our teachers will respond to us, but they're all so busy and we're out of the, yeah. So that's where it, kind of turned into this. Well, let's explore a mentorship program. So I reached out to a few people earlier on. Those are the ones who filled out the survey. And one of the questions was, would you be interested in a mentorship program? Every single person wrote yes in all caps. So we were like, okay, definitely there's interest. We haven't figured out the model or the cost or anything like that. So we can definitely obviously continue having discussions around that. But just excited to kick this off. We kind of wanted to do sort of a meet and greet and just see, if there's interest. So that's where we are. So nothing concrete yet.
So that was my question too.
Yeah.
Cool. Yeah. So that's what. So I think the next steps are for Dr. Bharath to figure out a mentorship program model. Our inputs will obviously help him figure out what model is workable. Not our inputs, your inputs. And then once there is a model in place, we'll reach out again, send out some notifications and say that this is what is possible. And then you guys can start participating in a mentorship program of sorts. We'll send out another survey after this. So if you guys can talk a little bit about, I would like twice a month time with Dr. Bharath, or, I would like X number of 30-minute sessions. That's how my mind works. Any kind of inputs like that will help Dr. Bharath formulate, okay, so this is what works for you guys, and see, kind of figure out what will work according to his style. And the other thing is days of the week. Those kind of inputs will help him understand how it works in the Western world. You guys could say, I can't talk to anybody on the weekend, so that'll give him an inputs. Or I can talk to people only on the weekends. That'll give him some inputs. So any inputs will help him figure out this is a kind of model that will work in the US.
Is there any whereabouts in India that I can have the connection with Dr. Bharath if I ever go to India?
Yeah, so we'll send out all that eventually. So we'll send out Dr. Bharath's website as well. So if you go there, you can visit his clinic. We'll send out all that. Absolutely. This is a way for us to kick off this interaction model. That's what this is. Obviously, there's going to be more. What it is, we don't know yet. We thought we should have a couple of hour seminar to figure out. Let's introduce both sides together. So we've done that. I'll talk to Dr. Bharath again. We'll figure out some model and then share it with everybody. So first thing I want to say is to all of you who've spent 2.5 hours of your time on a Sunday in front of Zoom, thank you for participating. Thank you for your questions before, and thank you for participating here. Dr. Bharath, I'll turn over the floor to you now. Just before that, I think this has been phenomenally helpful, just looking at the body language of people and the interaction. I think it's been helpful for everybody. I like the Sanskritam parts of it. That's the only thing that I could understand. I didn't understand any of the Ayurveda part of it. Thank you very much for spending.
That is actually the idea. Everybody should understand Ayurveda. That's what I feel. The whole world has to understand Ayurveda. And I'm happy that from a Sanskrit point of view, you are understanding Ayurveda. From an Ayurvedic practitioner's point of view, we understand Ayurveda.
Right.
So the whole aim, I think, is to take Ayurveda to the world. That is my, what to say, that is what I'm here for. That's what I believe.
Thank you
I hope
very much.
people have benefited from this. Thank you for giving me your time. It's not very simple to give your time. Time is a luxury that I don't have. So I work somewhere around 16 hours per day. So time is a luxury that I don't have. So thank you so much for being here. And hopefully you gained something from this. I gained a lot from this. I came to know how I can practice Ayurveda in the US, at least a little bit. So when I come to the US, I'll be able to practice a little bit of Ayurveda. Sure.
Wonderful. Wonderful.
Thank
All right.
you.
Thank you very much, everybody. Thank you very much, Dr. Bharath. We'll conclude today and we'll talk again. Dhanyavada. Namaste.
Dhanyawada.
Dhanyawad.